Aside from the dangers posed by the presence of heavy metals and toxic chemicals reportedly found in tampon in recent studies, women are still exposed to other risk factors attributed to the use of tampon. In this video, I want to bring your attention to some biological agents like bacteria, which are capable of producing toxic substances known as toxic shock syndrome toxin. This toxin is capable of causing life-threatening conditions associated with the use of tampon in women. Before I proceed to talk about toxic shock syndrome toxin, I want to explain what tampon is for the sake of my audience. A tampon is a small rod-like absorbent cotton product inserted into the vagina to absorb menstrual blood during a period. It is similar to a sanitary pad, but the only difference is that the tampon is more discreet. It's not visually noticeable, unlike pad. Okay, now let's talk about toxic shock syndrome toxin. I'm going to break down some of these terms to a layman understanding so that you can understand what I'm trying to talk about. Okay, first, what is toxic? Toxic means anything that is harmful or severely harmful to your life or negative to your health. Okay, let's say toxic relationship, for example. Then we talk about shock. Shock is a state of medical emergency. Okay, it occurs when the body doesn't get enough blood flow, when the blood flow is very low to the tissue, so there's no enough oxygen supply to all the vital organs of your body. Okay, so the body begins to shut down itself. All right, the person begins to start feeling weak, the heart will start beating faster than usual, starts sweating, becomes confused, anxiety starts setting in. Okay, that is when you say somebody is having shock. There are so many types of shock, which I'm not going to dive into, about 4 or 5 types of shock. When you hear syndrome, it's not a very big term. It's just a medical jargon that is used to represent a group of signs and symptoms or the pattern of behavior of a particular disease. Okay, that is what they call syndrome. Then, talking about toxin. Toxin means poison, anything that is poison that is produced by biological agents. Like bacteria can produce toxin. Snake, the venom of snake is regarded as toxin. Another term I'm going to define for you is the names of those bacteria, okay, so that it doesn't sound strange in your ear. Okay, when you hear something like Staphylococcus aureus, staph it means a bunch, something that looks like a bunch of grape. That is meaning of staff. Then coccus means round shape. They are round in nature. Then aureus it means golden, something that looks golden. So when you hear Staphylococcus aureus, it simply means a bacteria that look like a bunch of grape, that are rounded and looks like a bunch of grape, that is golden in color. That is what Staphylococcus means. Okay, I don't want to go into microbiology to start explaining the classification and all that. Okay, so some of these bacteria are normal floras that live in our body. They don't cause any harm. Okay, for instance, Staphylococcus can be found in the nostrils, can be found in the vagina, sometimes it's on the skin, so they don't cause any harm. All right, they are our normal flora. Streptococcus pyogenes. Strep means they are in chain, like you can see from the picture on this video. Okay. Antigens are strange substances that can trigger the body's immune system to produce antibodies. Okay, the immune system is our body's defense system. Antibody, on the other hand, they are more like trained professional soldiers that are guarding our body. Superantigen, on the other hand, are proteins that can cause our body's defense system to overreact, leading to massive release of very dangerous cytokines that can lead to shock. Okay, I'll give you one scenario so that you understand what superantigen is. Okay, it's more like, for example, a rat creeps into someone's room and begins to make some kind of noise that resembles that of a dinosaur or a lion. You know, the rat is displaying in a corner of the house and making some kind of strange sounds. Then the owner of the house, thinking that it is a lion, goes inside his armory to get a big gun. Let's example, he gets a bazooka or he picks up a hand grenade and starts throwing at every corner of his house, destroying all his properties just because of the rat that just crept into his house. Okay, that is what the superantigen does. The superantigen makes the body to feel like there's a very heavy threat. So now it begins to release all its arsenal to destroy that particular intruder that gets into it. So toxic shock syndrome toxin is a superantigen that is produced by Staphylococcus aureus and Streptococcus pyogenes. Okay, they trigger massive release of cytokines. This immune response triggered by this toxic shock syndrome toxin can lead to shock, especially in women using tampon during menstruation. Talking about the symptoms of toxic shock syndrome, this is characterized by high fever, extremely low blood pressure, flu-like symptoms, vomiting, diarrhea, confusion, dizziness, fatigue, muscle ache, and some other symptoms. So if you are using tampon and you begin to notice this symptom, rush immediately and seek medical help. Before I proceed, if you have watched up to this point, I want to say a very big thank you to you. Please subscribe to my channel. The good news is that this particular danger or risk of toxic shock syndrome associated with the use of tampon can be prevented by the following measures. It can be prevented by avoiding the use of tampon. In situations where tampon use cannot be avoided, especially in women participating in sports such as swimming, it is advisable to change the tampon at least every 4 to 8 hours. This will help to minimize the risk of formation of toxic shock syndrome toxin. Use sanitary pad instead of tampon, especially when going for a long road trip or during night sleep. Wash your hand thoroughly before or after inserting tampon. Be gentle when inserting or removing tampon. Use a lubricating jelly when inserting tampon, especially when the flow is light or during the last day of your period. This is to reduce friction and minimize the risk of scraping the vaginal wall. Do not use tampon if you are not menstruating. Rush to the emergency department in the nearest hospital if you noticed any of the signs and symptoms mentioned earlier. There are a lot of complications associated with toxic shock syndrome. This can lead to multiple organ damage. It can affect the liver, the kidney, the heart, the brain, or possibly lead to the death of this individual affected by this syndrome. Toxic shock syndrome is a rare but one of the preventable dangers associated with the use of tampon, aside from the presence of heavy metals or toxic chemicals found in tampon. So thank you very much for sticking with me to the end of this video. And if you have not subscribed, please subscribe. I'm going to be bringing you more important health tips and information. Okay, and do not forget to hit the notification bell so that anytime I upload new video, you'll be the first to get it. And please share this video, share it to your friends, your girlfriend, your wife, your sister, because it's going to save a lot of life. Because they say information is power. So I'm leaving this power to all of you. Bye.